Hi, and welcome to our virtual program introduction. I'm Emma Fields, and I'm the program director here at VCU. I've been here since 2013, and I've been the program director for 7 years. I specialize clinically in GI and GYN cancers and have a big interest in medical education, working with residents and medical students. I want to tell you some of the most important things about our program first. We definitely prepare you to get an awesome job. Here's a list of the residents that have graduated over the last handful of years, and just to show you some of the geography and practice type that they're in. Our residents don't have a hard time getting a job. They get jobs in private and academic practices, depending on their clinical interest. And we definitely use our network to help them as much as we can. We definitely prepare you to excel clinically as a radiation oncologist. We've been told time and again that when our residents graduate and go into practice, that they are notably ready to hit the ground running. We have a clinically heavy rotation schedule. It's 42 months of clinical rotations, and each rotation is a 3-month disease site specific block with a 1-month optional block at St. Jude to get proton as well as pediatric experience. We have 6 months of guaranteed research with extensions as needed or wanted, and there's no cross coverage. So our residents are very productive in research and other areas of interest during their primary clinical blocks as well. We also prepare you to pass your boards, both physics, radiation biology, clinical, and oral boards. There's a lot of protected time for education. The education program will tell you more about when you interview with us, but we've worked on several iterations over the years. And the way that we're currently doing it is it's co-led each disease site block with an attending and a resident. And it's a flipped classroom kind of setup. So it's more intensive. It's not just a resident presenting a PowerPoint. It's journal clubs, it's debates, it's interactive, contouring, plan review, and really high yield. We also have protected time on Tuesday afternoons where there's dedicated time for physics and radiation biology. Residents have the opportunity to invite at least 2 visiting professors per year. The faculty put on a yearly mock oral exam that's typically in February. We have access to RADONC questions, and we use that also throughout the year to check how everyone's doing. And then I'll tell you more about our hands-on and educational experiences and workshops as well. So now I'm going to tell you the top 10 reasons to come to VCU Radiation Oncology. Obviously, there's more than 10, but these are just the top 10 that come to mind, and they're in no particular order. Coming in at number 10, we have our VA experience. Now, VA experience isn't unique to our radiation oncology program. However, I think our dedicated faculty and the team we have really makes this an awesome experience. We have 4 dedicated radiation oncology faculty, as well as physics and fully staffed clinic. It's also where residents get to do LDR prostate cases. Of course, the VA has a different mix of patients, and so does the experience at one of our community hospital sites. Residents typically go here when they're working with our breast or prostate attending, and it's typically just 1 clinic day a week on that service. But it's a unique opportunity to see how, as an academician, you can also interact with private practice groups, see the different style of nursing, different patient population, and have that experience as well as you're thinking about the type of career that you might want to choose. Coming in at number 8, we have a brand new cancer center full of new technology. We moved in here in December of 2021, and the whole second floor is for our clinical radiation oncology department. Here from left to right, you can see pictures of one of our new treatment machines. It's a TrueBeam, and then in the middle, the MRI simulator. And on the right is the Meridian treatment machine. The second floor also has our brachytherapy suite, CT simulator, and the clinic. And then the resident space and faculty offices are all above that on the third floor with lots of bright windows. Number 7, we have a diverse patient population. As I mentioned, the residents have experiences at the VA as well as at our community hospital. And then our downtown main site is a very large catchnet hospital. So we cater to an underserved urban population as well as a very broad rural population. We are a known name in cancer care with big clinical trials, and we also take care of inmates. So on any given day, you're taking care of a huge diversity of patient population with a huge variety of needs from us and things that we can help them with. Number 6, our department is definitely committed to resident education. I mentioned before that we have workshops and educational time that's protected. We have the most fantastic physics instructor. There in the picture, you can see Dr. Tim Ritter, who you're going to meet on interviews, getting recognized last year as the Aero Educator of the Year, which he has gotten several times and is well deserved. And then one of our most recent visiting professors, Dr. Rachel Jimenez, with our resident group. We just love having visiting professors, and it's a great time for residents to get to network and ask questions and get some mentorship from outside sources. Here's an example of one of our resident workshops. This is our introductory curriculum, otherwise known as IROC. This is something that I actually worked on with Rachel Jimenez, and we replicate this basically every summer. This is the simulation workshop. So here you can see this is from the past summer. Our residents, one of the newbies getting fitted with a head and neck mask on the left, and then Eversina there on the right, being hazed, getting her tattoo. But it's great to see what our patients go through and then be able to describe to them much better in the clinic what their experience will likely be from firsthand experience yourself. Here's our annual cheers picture. Every year we drink some oral contrast so that when you're advising your patients to drink that for prep, you can at least tell them it's not that bad or tell them what flavor you prefer. Here's an example of another workshop that we do. This is our GYN workshop. We have a great space for this in our new department, in our prep recovery space, procedural area, and clinical planning area. This is a time where residents get to use the actual equipment, but have no time pressure of a patient under anesthesia, can touch all the applicators, take your time putting it together, see what it's like to actually use the ultrasound, and spend some time with some of our medical physics team as well to work on treatment planning and understand some of the behind the scenes. Now hitting our top 5, I think this is one of the most important things is that we have a collegial resident and faculty group. This is from just a few weeks ago. This is at my house. We had a welcome party for our new residents and included significant others, and you can see children as well, and just had a great time. Here's some other examples. This is from our most recent graduation of Ross Taylor and Reed McDonough. We like to have a lot of fun with that and have a great turnout. And here's a reception after a department party, hanging out afterwards with the residents. There's some really great places to sit outside almost year round in Richmond. Now, number 4, I think this is quite unique and not seen at every program. At VCU, we have an excellent connection with the School of Medicine and really strong medical student engagement. We have 2 different third-year rotations where medical students are exposed to radiation oncology. We have a 2-week elective option and then a 4-week ambulatory option. And then we have a really strong radiation oncology student interest group where we have a shadowing program for M1 and M2 students. So we're really finding that bringing these students in earlier, we can get them interested and engaged, get them involved in research. And here's some pictures from some recent students, some of which are interviewing and one recently matched. At meetings and match day, being excited about their choice for radiation oncology. Now, number 3, we have a strong commitment from our faculty towards resident research. We have a resident research committee that works with each resident when they're preparing to go on their research rotation. And that's composed of physics and medical faculty. Our residents have a really diverse interest, and all of those interests are encouraged. Here you can see Joe Wilding, one of our chief residents. He's been a member of the Government Relations and Economic Committee through ACRO and has done a lot of work in that regard. Here he is getting his Research Travel Grant Award. In the middle is Amanda Stark. She has done some research on medical education and is also writing a prospective protocol for cervix cancer. And then you can see Naveed here on the far right. He is working on a new invention for an applicator for brachytherapy also. And this is just a small example, but definitely make sure you ask our residents and chat with them about their interests and opportunities that they've had while they've been here. Getting into the top 2, here we go. Top 2 is brachytherapy, brachytherapy, brachytherapy. We do a lot of brachytherapy. We have a fantastic brachytherapy suite, which includes 2 fully stocked procedure rooms that are basically interchangeable. One of them connects to the MRI simulator. And then we have a prep recovery area that's separate with 4 bays for patients either waiting procedures or recovering. We have 5 days of anesthesia support and dedicated physics, nursing, and therapy coverage. We do breast brachytherapy. I do the GYN brachytherapy, and that's the full gamut of intracavitary, obviously cylinders, some TNOs, TNRs, lots of hybrid cases, and quite a lot of interstitial cases as well. We do prostate HDR downtown and LDR at the VA. And then a smattering of other things, sarcoma, skin, eye, rectal, esophageal, some other things that are less common, come through periodically. And top 1, truthfully, Richmond is just such a great place to live. I want you to think when you're choosing a program, you are going to live there for 4 years, so make sure it is somewhere that you're going to enjoy living. I think the nice thing here is that no matter where you choose in any of the surrounding areas or within the city, you can get almost everywhere in Richmond within about 15 minutes. This is overlooking the city. We're right on the James River, which is a gorgeous place to swim and hike or mountain bike. There's also Class 5 rapids, lots and lots of green space, and lots of activities for singles, young couples, as well as families. So in summary, here's our top 10 list. Number 10, VA experience. Number 9, community hospital experience. We have a new cancer center and technology, diverse patient population. Our department is definitely committed to resident education. We have a great resident group. I think you'll see that when you meet them. We have great medical students as well, and lots of engagement, lots of opportunity to teach and mentor. The faculty are committed to education as well as resident research, lots of opportunities for brachytherapy training, and truly Richmond is a great place to live, so we hope you'll come visit. If you have any questions, please contact Jo Lombardi. Here's her email. We look forward to seeing you in January. Bye.